Dr. Margaret Chan, from the People's Republic of China, obtained her medical degree from the University of Western Ontario in Canada. She joined the Hong Kong Department of Health in 1978, where her career in public health began. In 1994, Dr. Chan was appointed Director of Health of Hong Kong. In her 9-year tenure as director, she launched new services to prevent the spread of disease and promote better health. She also introduced new initiatives to improve communicable disease surveillance and response, enhance training for public health professionals, and establish better local and international collaboration. She effectively managed outbreaks of avian influenza and of severe acute respiratory syndrome, SARS. In 2003, Dr. Chan joined WHO as Director of the Department for Protection of the Human Environment. In June 2005, she was appointed Director, Communicable Diseases Surveillance and Response as well as representative of the Director General for Pandemic Influenza. In September 2005, she was named Assistant Director General for Communicable Diseases. Dr. Chan was elected to the post of Director General on November 9, 2006. The Assembly appointed Dr. Chan for a second 5-year term at its 65th session in May 2012. Dr. Chan's last term began on July 1, 2012 and ended on June 30, 2017. Margaret Chan, born 1947, Hong Kong, is a Hong Kong-born Chinese civil servant who served as Director General, 2007-17, of the World Health Organization, WHO. Chan attended Northcote College of Education in Hong Kong before moving to Canada, where she earned B.A. 1973, and M.D. 1977, degrees from the University of Western Ontario. She also received a Master of Science degree in Public Health, 1985, from Singapore National University. She joined the Hong Kong Department of Health in 1978 and became its director in 1994. She served as director for 9 years, during which time she focused on communicable disease surveillance and response and on improving training for public health professionals. Chan's leadership during a time of crisis was widely commended after the first human cases of the deadly H5N1 bird flu virus appeared in Hong Kong in 1997. Her response included an order to destroy the city's entire poultry stock, some 1.5 million birds. The order, carried out within 3 days, allowed authorities to bring the outbreak under control and possibly avert a pandemic. Chan also elevated her international profile with her management of the 2003 SARS outbreak, which claimed the lives of nearly 300 persons in Hong Kong, though some critics faulted her for not acting more aggressively after the outbreak initially appeared in China's neighboring Guangdong province. From 2003 to 2005, Chan served as director of WHO's Department of Protection of the Human Environment, and from 2005 until 2007 she was WHO's Assistant Director General for Communicable Diseases. Chan succeeded Lee Jong-wook of South Korea as Director General of WHO a few months after his unexpected death. She and 10 other candidates were recommended for the post by their respective governments, and, after 4 rounds of balloting by WHO's executive board, Chan emerged as the nominee. Her selection was confirmed during a special session of the World Health Assembly on November 9. Supporters praised Chan's ability in handling crisis situations, pointing to her experience in managing the bird flu and SARS outbreaks. Chan officially became Director General in early January 2007. In her first speech after taking the position, she outlined her specific goals of improving the health of people in Africa and of women around the world. All regions, all countries, all people are equally important, she stated, but we must focus our attention on the people in greatest need. In 2009, during an ongoing outbreak of swine flu that began in Mexico and subsequently spread to countries worldwide, Chan was confronted with the difficult task of assessing the potential global health impact of the disease. On June 11, 2009, following a series of meetings with an emergency committee from whom she sought scientific evidence on which to base her decision, Chan officially declared the swine flu outbreak a pandemic. It was the first pandemic to be declared since 1968. Critics later charged that Chan had overreacted, though some estimates placed the number of dead at more than 550,000. Chan, who was re-elected Director General in 2012, faced other health crises, notably an outbreak of Ebola in Africa, 2014-15, and the spread of the Zika virus in the Americas, 2015-16. Her handling of both situations drew criticism, some alleging that she was slow to respond, especially in the case of the Ebola outbreak. In addition, there were growing calls to reform the WHO, which was perceived as unwieldy, lacking in coordination, and unable to effectively oversee its sprawling network of regional offices. Despite such challenges, Chan drew praise for her efforts to promote universal health care and for prioritizing women's health. She stepped down as Director General when her second term ended in 2017. Margaret Chan Fuchun, born August 21, 1947, is a Chinese-Canadian physician and politician, who served as the Director General of the World Health Organization, WHO, delegating the People's Republic of China from 2006 to 2017. Chan previously served as Director of Health in the Hong Kong government, 1994 to 2003, and representative of the WHO Director General for Pandemic Influenza and WHO Assistant Director General for Communicable Diseases, 2003 to 2006. In 2014, Forbes ranked her as the 30th most powerful woman in the world. In early 2018 she joined the Chinese People's Political Consultative Conference, CPPCC. She was widely criticized for her handling of the 1997 H5N1 avian influenza outbreak and the 2003 SARS outbreak in Hong Kong, and for her frequent travels while serving as Director General of the WHO. Early life and education. Chan was born and raised in British Hong Kong. Her ancestors came from Shunda, Guangdong. Chan received a professional degree for teaching home economics at the Northcote College of Education in Hong Kong. She received a Bachelor of Arts with a major in home economics in 1973 and a Doctor of Medicine in 1977 from the University of Western Ontario in Canada. She received a Master of Science, Public Health, from the National University of Singapore in 1985. Chan completed the Program for Management Development, PMD 61, at Harvard Business School in 1991. Career. Early career. Chan joined the government of British Hong Kong in December 1978 as a medical officer. In November 1989, she was promoted to Assistant Director of the Department of Health. In April 1992, she was promoted to Deputy Director and, in June 1994, was named the first woman in Hong Kong to head the Department of Health. Director of Health in Hong Kong, 1994 to 2003. Chan survived the transition from British to PRC Czar rule in June 1997. Her profile was raised by her handling, in those positions, of the 1997 H5N1 avian influenza outbreak and the 2003 SARS outbreak in Hong Kong. After the first cases of the H5N1 died, Chan first tried to reassure Hong Kong residents with statements such as "I ate chicken last night" or "I eat chicken every day, don't panic, everyone." When many more H5N1 cases appeared, she was criticized for misleading the public. She became a symbol of ignorance and arrogance, epitomizing the mentality of business as usual embedded in the ideological and institutional practices within the bureaucracy, especially after the handover. In the end, she was credited for helping bring the epidemic under control by the slaughter of 1.5 million chickens in the region in the face of stiff political opposition. Her performance during the SARS outbreak, which ultimately led to 299 deaths, attracted harsh criticism from the Legislative Council of Hong Kong and many people with SARS and their relatives. She was criticized by the Legislative Council for her passiveness, for believing in misleading information shared by the mainland authority, and for not acting swiftly. She was also criticized for a lack of political wisdom was evident in her indifference to media reports and widespread public fear at that time. On the other hand, the SARS expert committee established by the HKSAR government to assess its handling of the crisis, opined that the failure was not Chan's fault, but due to the structure of Hong Kong's healthcare system, in which the separation of the hospital authority from the public health authority resulted in problems with data sharing. Assistant to Dhu Chan left the Hong Kong government in August 2003 after 25 years of service to join the World Health Organization. She could initially not take up a post of Assistant Director General because the Chinese government did not give its clearance. She was given the post of Director, Sustainable Development and Healthy Environment Department, until she could move on, in 2005, to the position of ADG. From 2003 until 2005, Chan served as the representative of the World Health Organization Director General for Pandemic Influenza and as Assistant Director General for Communicable Diseases. Director General of WHO, 2006 to 2017. Chan served 2 terms of 5 years apiece as Director General of the WHO. Appointed to the post in November 2006, Chan's first term ran through to June 2012. In her appointment speech, Chan considered the improvements in the health of the people of Africa and the health of women to be the key performance indicator of WHO, and she wants to focus WHO's attention on the people in greatest need. On January 18, 2012, Chan was nominated by the WHO's executive board for a second term and was confirmed by the World Health Assembly on May 23, 2012. In her acceptance speech, Chan indicated that universal coverage is a powerful equalizer and the most powerful concept of public health. Chan's new term began on July 1, 2012 and continued until June 30, 2017. First term. In February 2007, Chan provoked the anger of humanitarian and civil society groups including Doctors Without Borders by questioning the quality of generic medicines while on a visit to Thailand. In 2010, Chan was criticized for crying wolf about the 2009 flu pandemic, which turned out to be much milder than expected. After a visit to North Korea in April 2010, Chan said malnutrition was a problem in the country but that North Korea's health system would be the envy of many developing countries because of the abundance of medical staff. She also noted there were no signs of obesity in the country, which is a newly emerging problem in other parts of Asia. Chan's comments marked a significant departure from that of her predecessor, Gro Harlem Brundtland, who said in 2001 that North Korea's health system was near collapse. The Director General's assessment was criticized, including in a Wall Street Journal editorial which called her statements surreal. The editorial further stated, Ms. Chan is either winking at the reality to maintain contact with the North or she allowed herself to be fooled. In 2011, because of financial constraints in donor countries, the WHO slashed its budget by nearly $1 billion and cut 300 jobs at its headquarters under Chan's leadership. Second term. The WHO was accused of deferring to the Syrian government of President Bashar al-Assad when polio made a comeback in that country in late 2013. In 2014 and 2015, Chan was again heavily criticized because of the slow response of the WHO to the Ebola virus epidemic in West Africa. In 2016, at the request of the WHO, Chan launched the Health Emergencies Program. After WHO. In 2018, Chan joined the Task Force on Fiscal Policy for Health, a group convened by Michael R. Bloomberg and Lawrence H. Summers to address preventable leading causes of death and non-communicable diseases through fiscal policy. The same year, she was appointed to the Council of Advisors of the Boao Forum for Asia. In December 2021, during the 2021 Hong Kong legislative election, Chan said, of the election where only patriots could serve in the government, the new election system is going to be very good for Hong Kong, for Hong Kong's long-term development, and for Hong Kong's democracy to take a step-by-step approach. In August 2022, after Nancy Pelosi visited Taiwan, Chan said as the number 3 figure in the U.S. government, Pelosi visiting Taiwan on a U.S. military plane is a gross interference in China's internal affairs, seriously undermining China's sovereignty and territorial integrity, wantonly trampling on the One China principle, seriously threatening the peace and stability of the Taiwan Strait, and seriously damaging Sino-US relations. Other activities. Exemplars in global health, member of the Senior Advisory Board, since 2020. Recognition. In 1997, Chan was given the distinction for the Fellowship of the Faculty of Public Health Medicine of the Royal College of Physicians of the United Kingdom and was also appointed as an Officer of the Order of the British Empire by Queen Elizabeth II. In 2014, Chan was ranked as the 30th most powerful woman in the world, based on her position as Director General, by Forbes. Her ranking increased from 33rd in 2013. Personal life. Margaret Chan is married to David Chan, who is an ophthalmologist. Thank you for watching this video.